Hi, I'm Dr. Jesse Schulz. I'm a physical therapist. I work in McWanago, Wisconsin, and I'm going to be showing you today some exercises to do for neck pain. Specifically, what we'll be doing is neck strengthening and shoulder girdle strengthening for some of the common muscles that, if they're not strong enough, can affect your neck pain for the worse. Not to say everybody that has neck pain will get benefits from these exercises or from strengthening, but I usually find a combination of these exercises with or without hands-on therapy, whether it be manipulation or massage, tends to be fairly effective for most people that have neck pain. And if you do any of these exercises, I would encourage you to consult with your doctor or your physical therapist first. But they're many times safe if you're doing them properly, and they either work or they don't work. I will be showing you for some of these a little progression or describing how to make it harder or easier for yourself if you're not quite ready for the exercise. Thanks, and I hope you enjoy this video as you watch. So for this exercise, we're going to be doing shoulder external rotation, where I'm going to be holding onto a band. I'm going to have it in a doorway that I'll show you how to do that in a moment. And we're going to be moving our shoulder from this position to this one here. I know it looks like we're using the kind of forearms and arms for this, but really the motion comes at the ball in the socket, where you're going from a position somewhere in here to where we're trying to get the forearms straight up in the air. So you can either use a sport cord for this, or I've got a piece of TheraBand that's got a knot tied kind of in the center. And what we're going to do is I'm going to close this in the doorway. And one of the keys for this is to get it really high up in the air. This is probably a pretty good angle. It's probably about a foot above my head, but I can go even higher, and that would be even better yet. Make sure the door is closed firmly over the band. You can either put it at the edge of the door that closes with the handle, or at the other end where it's got the hinge points. Either one works very well for this. I'm going to hold the band with both hands. I'm going to put a little bit of tension on it. I'm going to pull back with my elbows and rotate back with my forearms. Hold for about 3 seconds. Slowly let my arms go forward. Pull back with my elbows, pull back with my forearms, hold for about 3 seconds, let it come forward. I would work towards a goal of 20 repetitions or 20 pulls with this. I would do 2 to 3 sets, erring on the side of doing 3. And then you only have to do it 2 to 3 days per week if you do it 3 sets. If you only do 2 sets, I would say usually 3 to 4 days per week. If you have a band, or band options for you, this works the best for making it easier and harder. A stiffer band will make it harder very quickly, and a lighter resistance band will be the easiest way for you to make it a little bit weaker if your shoulder girdle strength isn't quite there for this yet. Now, the next exercise we're going to be doing is an incline push up. You either need a doorway, door that's firmly closed, or a wall for this. Now, realizing that the shoulder motion we're going to do for this is protraction. Arms up like so. Protraction is this motion here, where you reach forward with the arms by gliding your shoulder blades forward on your rib cage. That's the most important part of this. I'm going to put my hands up on the wall again, fairly high. I'm going to walk my feet back so I'm on a steeper angle. Keep your stomach tight to not let your back sag. And what you're going to do is you're going to bend your elbows a little bit to bring yourself towards the wall. And then as you straighten your elbows, you're going to push yourself away by doing that protraction motion at the shoulder. So a little bend at the elbows to raise or lower yourself down towards the door of the wall. Straighten the elbows as you push yourself away. Now, the easiest way to make this harder for yourself is to take your body on this angle and make it lower, 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 lower. So what you can do for this is you can first off take your hands, put them lower on the wall, move your feet a lot further away. This will increase resistance against gravity. Or instead of using a vertical surface like a doorway or a wall, you can use a chair. And eventually after that, if you wanted to, you could progress to using an exercise ball for this as well, with a ball on the floor or a ball rested against a couch or a chair that is braced, again, of course, against a wall. Otherwise, it'll want to slide on you. The first exercise that we're going to do for the neck is called a head lift. But you need to make sure you understand the fundamental motion of upper cervical flexion for this, which I'll show you in a minute. And if you can't do 10 of these for 10 seconds each, you're not ready to try the head lift. So the head nod essentially is a prerequisite. And if you want to think about these muscles as kind of like the abs of the neck, the first step would be like a neck crunch, and the next exercise would be like a neck sit-up. Not truly like that, but I think most people tend to latch onto the concept of this exercise fairly well with this. So the head nod, all you have to do, again, is lie on your back on a fairly firm surface. You're going to tilt your chin down while keeping your head on the surface and hold your chin down for 10 seconds. And I would repeat that 10 times. Notice it's a very subtle motion. Now, if I can do 10 of those for 10 seconds each and my neck feels okay, then I'll progress to the head lift, which is tilting my chin down while keeping my head on the table. And as I keep the chin down, I'm going to lift up 1 centimeter, and then I'm going to lower my head back down. Tilt the chin down, lift up 1 centimeter, hold for 2 seconds, and lower back down. And repeat that. Now, my goal for the head lift is to do 20 of them, 3 sets, 3 days per week. That usually seems to work the best for most people that I work with. When we're doing the head lifts, some people find that they get a lot of pain in the back of their neck or pulling. If that's the case, sometimes you're just too tight back there and you need a massage. Other times, even though it's not the best to do this, you can put a pillow behind the head to raise yourself up just a little bit. I think that is helpful for some people, but for most people, it's just something that if we can work around that and you don't need to use a pillow, it's better. Now, the next exercise is going to be the thoracic lift. My forearms are going to be down on the table, and I'm going to be pushing down with my elbows and down with my head at the same time. When I do this, I want to try to lift up my area in my chest here. I'm trying to lift my thoracic spine off the table, which I'm trying to get the base of my neck right about here, all the way down to my mid-back for a woman where the bra strap would be, or a little bit lower, off of the table. So I'm going to push with my head, push with my elbows, lift my upper back up, hold for about 10 seconds. And I would try to repeat 10 times. Now, when you're doing this exercise, if you have any pain with this, again, you could potentially try using a pillow. But other times, if you have shoulder injuries or anything like that, as with any of these other exercises I showed you, sometimes you'll need more skilled help in understanding and knowing how to progress these. But this exercise usually is pretty effective, as most of us stay flexed over too much of our day, and this will basically help the muscles that do the opposite motion. I will put the ball, the apex of the ball, the top of the ball, underneath my sternum, the mid part of the breastbone. I'm going to keep my face looking down in the same direction as my chest, with my thumbs up towards the ceiling. I will slightly lift my sternum, keeping my head looking in the same direction as my chest. and then I lift my arms. You want to keep the arms at shoulder height or 90-degree angle to your body. Lift the chest, lift the arms, hold for several seconds. Usually people have enough strength to do this exercise, but if you feel like you are able to do this exercise fairly easily, you can also use a dumbbell. But make sure you keep your face looking in the same direction as your chest. Make sure your thumbs are up towards the ceiling if that's comfortable for you. And make sure you lift the chest before you lift the arms, and also keep it up as you're moving the arms.